Americans across this country are going to start getting notifications that their insurance premiums are up to doubling. We're talking about...
Say that again.
Your monthly insurance premiums are going to double for millions of people across the country.
At a time when we are already paying, by far, the highest prices in the world for healthcare, at a time when people can't afford it right now. So what happens?
That means people getting bankrupt over chemotherapy, people going to the pharmacy and not being able to get their insulin. And frankly, it means a lot of Americans are going to be in danger. And Republicans want us to rubber stamp that. So what are we going to say to that, Bernie?
Well, I'll tell you, it's not only be in danger. Let's be clear. And it doesn't make me happy to have to say this, but there have been studies out there that when you combine doubling premiums for the ACA and then throwing 15 million people off of Medicaid and the ACA, the result is, according to studies at Yale and the University of Pennsylvania, 50,000 low-income, working-class Americans will die every single year.
You just heard Senator Bernie Sanders and Representative Alexandria Ocasio-Cortez explain just how fucked we would all be if the Affordable Care Act's premium tax subsidies were to expire. That's not their words per se, but I don't think that they would necessarily disagree with my characterization of the situation, given how bleak it is. Because between that and the Medicaid cuts, more than 50,000 Americans could die every single year, as Bernie Sanders pointed out. And that's not just a number, by the way. That could be your brother, or your sister, or a parent, or a coworker, or one of your friends, or you. So Democrats are trying to use the shutdown to get Republicans to agree to reverse some of the cuts to healthcare made in the big bullshit bill. Now, I, for one, think that Democrats should be asking for far more. Nonetheless, Republicans are collectively lying about what Democrats are actually asking for. They're claiming that Democrats are demanding free healthcare specifically for undocumented immigrants, and that's why they won't agree to this continuing resolution to keep the government open. It's all about immigrants. But that is a huge lie. That is not what Democrats are asking for. They're not that cool. Democrats don't even support free healthcare for Americans, let alone undocumented immigrants. They're simply trying to stop healthcare costs from skyrocketing within the next couple of months. And I'll tell you how much that cost is going to go up in a couple of moments. So first, I have to address this idea that immigrants shouldn't have healthcare. I think it's so disgusting that Republicans are trying to dupe Americans into supporting a rise in the cost of their own healthcare simply to prevent undesirables from getting it. That drives me insane. That is demented, immoral, ghoulish behavior, because immigrants should be getting free healthcare. In fact, we all should be getting free healthcare. This is why I supported Medicare for all. But if you don't think that undocumented immigrants should have healthcare, one, you're a bad person. And two, them not having healthcare is actually bad for you as well, monetarily speaking. See, undocumented immigrants, they pay into our healthcare system through their taxes, yet they're not eligible to buy plans on the ACA exchanges that they're subsidizing. That's pretty fucked up. Some states have set up plans for undocumented immigrants, but that's few and far between. The fact is that immigrants are simply not eligible for federal healthcare programs. Republicans are lying to you about this. If you go on Twitter, they are pointing out how in the Democratic Party's demands, it says alien, and therefore that's evidence that they support undocumented people getting healthcare. Alien does not refer to undocumented immigrants, but since all they have are lies, they're trying to push this narrative that it's all about immigrants, again, because they want you to blame immigrants. But ask yourself, what happens when an undocumented worker falls off of a ladder and has to go to the hospital? Well, thankfully, because of a law signed by Ronald Reagan, of all people, they can go to an emergency room and they would be seen. In fact, this is what happens for all Americans, including if they don't have health insurance, right? But if an immigrant or uninsured American goes to the emergency room, they get seen, but they're unable to pay the bill. What do you think happens? Prices go up for everyone. Hence why a single-payer healthcare system is so crucial. Because when we're all in one big risk pool, it keeps prices down, and more importantly, it saves lives. Short of that, we have to keep pumping money into our predatory private system to offset the exorbitant costs. But it's better than the alternative, so that's what we have to do right now. But I say all this to say that it would be a net benefit to Americans if undocumented immigrants had healthcare too. But they don't. And that's really sad. And let's just pretend for a moment like there was no benefit for immigrants having healthcare to us. Like, pretend that it's just about them and not about us. Imagine if an immigrant were to get into a deadly accident, a really serious accident, and they needed healthcare. Do you expect them to just like bleed out and die in the streets? We're talking about actual human beings who bleed red just like you and me. So this idea that it's somehow bad for undocumented immigrants to have healthcare is inhumane and gross. And I'm sorry, you don't get to call yourself a Christian if this is your effective position. So I wish that Republicans were right about Democrats fighting for healthcare for undocumented people. I wish they were right about half the shit they say about Democrats. They're communists, they're socialists, but they're not, they're lying. Having said that, if Democrats back down and our healthcare premiums do increase, I don't think people fully comprehend how much more expensive healthcare costs will become. They could double or, depending on a plethora of factors, triple. I'll say it again. Healthcare costs could triple if this subsidy goes away. So if you look at this graph with data from the Kaiser Family Foundation, courtesy of a guest column by Steve Ratner for the New York Times, you can see that the average 55-year-old couple making $85,000 a year pays $7,225 for their annual healthcare premium that they bought on the Affordable Care Act exchanges. That amounts to about $600 per month thanks to the enhanced tax credit. Now, the premium enhanced tax credit that we're referring to here, this was introduced under Biden in 2021, and they were expanded under the Inflation Reduction Act. And without it, the same couple's premium would cost $20,792 annually, which amounts to $1,732 per month, meaning that their healthcare plan would triple without that enhanced tax credit. And this is what Democrats are trying to stop from happening, but we're not done yet, because when you factor in the proposed increase in their annual premium as well, which happens every single year, that adds another $3,742 to this particular couple's annual bill, bringing the total to $2,044 per month. So, like it or not, this couple will still be paying more for health insurance, around $900 a month when it's all said and done. But that's variable, because when you bring in the second portion of the graph, you can see that the distribution of proposed premium rates among the 300 companies offering insurance on the Obamacare exchanges, they're all raising prices, basically, most of them. The average is 18%, which is extremely high, but it surpasses 50% in some states like Arkansas. But this varies from state to state and based on your household income. So I'm going to link you to a tool from the Kaiser Family Foundation where you can input your information and get an estimate as to how much more you'll be paying without the enhanced premium tax credit. But needless to say, it would be catastrophic if the enhanced tax credit went away, given how high costs already are. We're talking about monthly healthcare expenses that are comparable to rent now. But the reality is that most Americans simply wouldn't be able to afford that, and they would just end up losing their healthcare coverage, meaning that they faced bankruptcy if they end up having a medical emergency, which is still a possibility even if you have insurance, because God forbid you ride an ambulance and they take you to a hospital that's out of network, or you undergo a procedure and your health insurance company chooses to not cover it. But I mean, without insurance, a medical emergency would definitely financially ruin so many Americans, and it's already the case that medical debt is usually the number one cause of bankruptcy in this country every single year. But without that shitty overpriced insurance that we can still buy through the exchanges, things would be so much worse. And the enhanced premium tax credit was so successful that it doubled the rate of Obamacare enrollees. You can see from this graph, also courtesy of the New York Times, that it did a fairly good job at stabilizing healthcare costs overall while leading to an explosion in new enrollees, which benefits all of us because more Americans having healthcare keeps costs lower for everyone. But if you look at the next graph, you can see why 50,000 more Americans are going to die every single year, because with the combined cuts to Medicaid and changes to tax law in the big bullshit bill and the death of the enhanced tax credit, you can see that around 17 million Americans in total will lose their healthcare by 2035. And it's death by 1,000 cuts. There's the arbitrary work requirements, as if it's good to deny life-saving healthcare to somebody that doesn't work. There's the repeal of rules simplifying eligibility and renewal, so less people are able to get it, not to mention the Americans who would lose Medicaid due to a lack of state funding, and a whole host of other small changes that amount to the Affordable Care Act effectively being gutted. And Ratner argues that that's what this is really about. Republicans couldn't repeal Obamacare outright, so they found a million different ways to undermine it and make it useless. It's what they always do. They gut government programs, make them less effective, and then they point to that as evidence that government-run programs don't work because they don't think that the government should work for the people. And they want you to think that the government can't work for the people. But the truth is that the government can be effective and work for the people. It's just a matter of fine-tuning it to represent the people and not oligarchs. Trump and his cronies reworked the government to be even more favorable to the rich. So government works. It's just a matter of like who you're making it work for. But did you know that in Trump's big bullshit bill, they actually provided a provision in there that lets rich people write off yachts, racehorses, and private jets? Do you think that's going to benefit the average, mom in Tuscaloosa working a 9 to 5? Do you think she's going to benefit much from that? Of course not. They did that shit. It is straight up class warfare. And while they're robbing you blind, they're trying to convince you that it's immigrants and trans people who are the real problem because they know that if you're still fixated on the wrong 1%, you'll be too busy fighting each other to take on the crooks at the top. And Americans fall for it every single time. Think about that. Republicans got Americans to think that the combined 5 trans athletes in K through 12 schools across the entire country, that's the actual number, by the way, look it up, is more of a threat to their children than poverty and income and wealth inequality. We're told that immigrants are taking all of our jobs while we're being replaced with robots as we speak, and you can see it. It's embarrassing. Like an immigrant isn't the one at the grocery store who checks you out. You do that yourself now. With robots. Like, why do you think they're cutting education? Because if they can keep you too stupid and illiterate to see what's really happening, they can keep taking advantage of you. That's how they maintain and reinforce the capitalist status quo that served them all so well. So Bernie Sanders and AOC are 1,000% right. Things are about to get a whole lot worse if our health insurance ends up doubling or tripling, because odds are your rent is also going to go up too. The cost of living is going to continue to rise as well. Your electricity is going to go up because of these AI data centers. And, if things keep getting more expensive and you end up falling through the cracks and become homeless, the cantankerous cunt dictator in the White House is just going to send in the troops to push you out of society entirely. And they'll repeat this process again and again and again until there's no one left except for rich, white Christian nationalists. But you should know that they're turning this into a conversation about immigrants specifically because they want to distract you from the fact that they're bleeding you dry. If the government frees up more resources by paying less to subsidize healthcare, well, think of all the other things that they can use that money for. They could fund more tax cuts for the rich or bombs for their defense contractor donors, right? They could buy more from them, bomb children. Like, they don't want to use that money to help us. They want to use that money to help themselves. And if you fall for their anti-immigrant class warfare bullshit again, you're not just a bad person. You're a useful idiot for the oligarchs who are robbing you blind. So wake up.
The Humanist Report is fake news. Mike only cares about Crazy Bernie and his wacky socialist ideas. Sad, very sad. I'm unsubscribing.